Welcome back. Let's continue with our discussion on nurses working under the Gauteng Health Department contract following the COVID-19 pandemic. They haven't been paid for the past 3 months. The nurses say they are still expected to report for duty. And for more on this now, we are now joined by Deputy Director General for Corporate Services in the Gauteng Health Department. And her name is Basani Baloyi. And she joins us via our Zoom link. Basani, thank you so much for joining us on the late edition. Can you confirm for us indeed if workers in the Gauteng Health Department, those who were under the COVID-19 contract, have not been paid?
Good evening. Yes, I can confirm that some of the nurses have not been paid.
And, you know, what are the reasons? We are hearing Jack Bloom says that you are giving them frivolous excuses in terms of why these workers have not been paid. You know, why have they been left in this predicament of non-payment for almost 3 months now?
I want to clear something. When we received the COVID-19 grant, which was reduced from 1.2 billion, 1.1 billion now to 600 million, we had to reprioritize our needs, and we agreed with all the CEOs of hospitals together with organized labor that, you know, this budget does not cater for everyone that was appointed in the previous year. And then we decided that, you know, the budget will be used to retain all professional nurses that were there up until the 31st of March, medical officers that were there until the 31st of March, and as well as the doctors who are our bursary holders that we have trained and they were unemployed at that stage. So that's what we did. And in addition to that, last year, we did not actually provide for all hospitals. So what we did also was to provide dentists for the dental hospitals that were not provided for, as well as other regional and hospitals that were not covered in the previous year. So those were the only categories out of the many categories that, you know, have been covered in the previous financial year. So the nurses that we are talking about, it's the submission that has been made as a special request by Dr. George Mkari, by Steve Biko, Pretoria's West Hospital, as well as Tshwane District. So these nurses were not catered for in the budget, and they were not part of the first approval. So these were the special requests that could have been made. And again, I also want to clear the fact that we directed all institutions to terminate all employees as at the 31st of March.
And it brings me to this question, Basani, that did you inform them on time, you know, that their contracts, you know, will be cancelled and will not be renewed? Because these are the same nurses who are saying that as much as we are not being paid, we are still expected to report for duty. If they are not being paid, why are they being allowed to come to work?
That's what I'm clearing, the fact that everyone has been terminated from the system. And when this request was made, it was made after, you know, that approval. So if they've been asked to come to work or there were other further instructions, they were given by the institutions themselves, not actually the central office. So the CEOs need to take full accountability for this particular, event, because of what they should have done was to follow what all the institutions have done, that, you know, they've terminated all the workers and started afresh based on the budget that they have. So the categories that we're talking about, they were not catered for. These are new requests. So what the institutions have done, for instance, at Dr. George Mkari, based on the balance of the numbers that they had, and also taking into account that they were not going to appoint other occupational categories, they had to repurpose, you know, their institutions and now add these nurses that we are talking about into the system, which the other institutions have not actually accommodated them. So it was their responsibility as an institution after the termination to explain to them that this process will have to follow a certain process, that the positions that, for instance, that George Mkari didn't want to or no longer needs immediately had to be abolished, and then we start the process of creation of posts, get approval so that they can be paid.
And yes, and it brings me here, Ms. Baloyi, it also brings me here. What will you be doing as the Gauteng Health Department to ensure that these workers who have been working for almost 3 months now are remunerated accordingly?
We will actually remunerate them, for the months that they've worked. And we have since actually approved that, this particular request. It is unfortunate that this process was not clearly articulated, to the affected employees. They should have been told from the beginning, because we appointed more than 1,000 professionals and all of them have been paid. It's only these ones, because it's a new process. We have to create these positions. We also need to actually get approval. So the CEOs of these affected institutions, out of the 37 that, have been allocated COVID-19 professionals, including this George Mkari and Steve Biko, the other professionals have been paid. So it's not the case that it's all the nurses in these institutions. It's a particular category.
And Ms. Baloyi, you're saying that you are in the process of processing their remuneration. When can they expect that money to make its way into their bank accounts?
We will be, I'll just promise you that, it is receiving, attention, and we'll make sure that, we keep them updated, on a weekly basis.
Is this a month? Is this a week? Is this a day? Because some of them, I'm sure you've seen that package, that some of them are close to losing their homes. Some of them are close to losing their cars. They want an answer in terms of when can they be remunerated.
We will be giving them an answer within the course of this coming week, because of all these processes are not run only by ourselves. We have to actually engage our colleagues in the Office of the Premier, the Provincial Treasury, as well as e-government. So it is receiving attention from our side.
And will you be taking any action against those CEOs who are responsible for remunerating these nurses and did not do so?
We'll definitely take action. We are going to look into this matter and find out where the delays are, because it did not come as a shock, because on a daily basis for 2 weeks, we were having meeting with all CEOs as well as HR managers to show them, and engage with them about, all the categories that have been approved. So they should have taken full accountability and explained to these categories that, their professional levels have not been approved and accommodated for in terms of the executive management decision, which they've been part of. And then they have made, a separate request a separate request to get them to be appointed in the system. Because of these are the only hospitals that are going to appoint those categories. The other hospitals, even if they need them, they did not actually appoint them based on the decision that we have taken, and again, in terms of the budget. So this institution have repurposed, their nursing requests so that, they can accommodate these categories, which were not initially taken care of through that budget.
Basani Baloyi, thank you so much for your time. That is Basani Baloyi. She is the Deputy Director General for Corporate Services in the Gauteng Health Department, saying that they will be communicating with those workers within this week. And of course, saying that they will be making a plan in terms of ensuring that workers are remunerated accordingly.